Good morning, students. Today in this video we are going to discuss about the kidneys. You can see I have the right kidney in the right hand, left kidney in the left hand. So we will describe each kidney, their surfaces, margins or borders, okay, and the structures of the hilum, and how to determine the side of the kidney, how to identify the side of the kidney, that also we will see. Now let's first see the right kidney. Okay, now you can see here, this is the right kidney. How I am telling it is right kidney? Look at the hilum of the kidney here. Look at the hilum of the kidney here. Now there are three structures from anterior to posterior. There are three structures from anterior to posterior. So I'll show you one by one. Now you can see here the anteriormost structure is the renal vein. This is the renal vein. Then posterior to the renal vein is the renal artery. This is the renal artery. This is the renal artery. Renal artery. So renal vein is here, anterior. Posterior to that is the renal artery, and more posterior to is the renal pelvis. So this is how you determine the side. So first you should know that in the hilum you have the first anteriormost structure is the renal vein, next you have the renal artery, and then you have the renal pelvis. So this order must be there, and you can see the direction of the ureter. This is the ureter coming down like this. So the direction of the ureter is going downwards like this. Okay, now I'll further tell you how to determine the side. Now let me see first, let's see the gross features of the kidney. Now you can see here, this is the upper pole, this is the lower pole. So this is the upper pole and this is the lower pole. Okay. So this is the upper pole of the kidney and this is the lower pole of the kidney. This is the medial margin of the kidney. This is the lateral margin of the kidney. This one is the lateral margin of the kidney. This is the medial margin. This is the lateral margin. This is the anterior surface and this is the posterior surface. Now anterior surface is convex. Anterior surface is convex, whereas the posterior surface is relatively flat. Now this you can appreciate when I show you this view. Okay, so in this view you can see the anterior surface is convex, whereas the posterior surface is relatively flat. Okay, so that is how you identify the surfaces. So anterior surface is convex, whereas the posterior surface is relatively flat. So that is how you identify both the anterior as well as the posterior surface. Now how the upper pole and lower pole? So this is the upper pole, which is related to the suprarenal gland, and then you have the lower pole here, So this is the upper pole and this is the lower pole. This is the medial margin, this is the medial margin, and this is the lateral margin. So very easy to remember. This is the medial margin, medially present, and this is the lateral margin, which is present laterally. Now along the medial margin, the hilum is present. This is the hilum is present. Now the structures of the hilum are very important, as I already described. Now the structures of the hilum of the kidney from anterior to posterior are: first one is the renal vein, second is the renal artery, and third one is the renal pelvis. So anteriormost is renal vein, next posterior to that is the renal artery, more posterior is the renal pelvis. So from the renal pelvis you can say the ureter is continuing downwards. So the direction of ureter is also important. It should be going downwards. The direction of the ureter is also important. Now with these features, now you can identify the side of the kidney. So first I identify, when I pick up this kidney, now let me see. Okay, I picked up this kidney. Now let me first identify the surfaces. So this is the anterior surface because it is convex. Now this is the posterior surface, which is flat. So I know which is the anterior and which is the posterior surface. Now let's look at the margins, the medial margin and the lateral margin. Now where is the hilum present? Along the medial margin. So this is the medial margin, there is no doubt in that, and then you have the lateral margin. Okay, in the medial margin we have the hilum. Okay, hilum is an entrance to a space within the kidney known as the renal sinus. So this is the hilum. In the hilum you can see all the structures are entering and leaving. The renal vein is leaving, the artery is entering, the renal pelvis is also leaving. Okay, and you have some other structures also. A lot of fat will be in the renal sinus. Okay, so the hilum leads to the sinus. What is renal sinus? Renal sinus is a space within the kidney. The entrance to the renal sinus is known as the hilum, and these are structures at the hilum from anterior to posterior I have already described. So that is how you identify the kidney, right and left, and you have to hold it in proper anatomical position. So this is how you hold the kidney in anatomical position. Okay, upper pole, lower pole, anterior surface, posterior surface, and then you have the hilum, that is the medial margin and the lateral margin, and in the medial margin you have the hilum, and in the hilum we have all the structures which already I have described. Now one more thing I want to tell you is the kidney has got 5 segments. One is the apical segment, the other one is the inferior segment. Apical is also known as superior. So superior segment is there, then inferior segment is there, and then you have anterior segment. Anterior segment is divided into antero-superior and antero-inferior, and then you have the posterior segment. Now these segments of the kidney are vascular segments, and they are supplied by segmental branch of the renal artery. Now why I am telling you this is sometimes what happens is in front of the renal vein a segmental artery might come out like this, and you might be confused. So that you have to keep in mind. So this is with the right kidney. Now let's see quickly the left kidney. So this is the left kidney. So this is the anterior surface, this is the posterior surface, this is the upper pole, this is the lower pole. So upper pole is related to the suprarenal gland. Then you have the medial margin, and you have the lateral margin, and in the medial margin you have the hilum leading into the renal sinus. In the hilum you have 3 structures. 3 structures from anterior to posterior. The first one is the renal vein. What you are seeing is the renal vein. Then you are having the renal artery, and then you are seeing the renal pelvis. So first is the renal vein, anteriormost is the renal vein, then you have the renal artery, and then you have the renal pelvis, and renal pelvis continues as the ureter. So this is the left kidney. This is the right kidney. Now this is something about the gross features of the kidney and the site determination. Now quickly let's see the gross internal features. So I have taken a coronal section. So let's see what are the gross features. Okay, so we have taken a coronal section here. We have taken a coronal section of the right kidney. Let's see what are the structures you have to see. So you can see the outermost pale area, that is the cortex. Okay, the outer area, the outer whitish area, what you are seeing is the cortex. Then you have the medulla. What do you have in the medulla? In the medulla there are renal triangular structures known as the renal pyramids. They have the renal pyramids. Okay, you have see a lot of pyramids, 1, 2, 3, 4. These are all the renal pyramids. Here also you can see the renal pyramids. Okay, so these triangular structures, what you are seeing, forms the medulla, and these are the renal pyramids. Now the apex of these renal pyramids is known as the renal papillae, and it opens in the minor calyx. Then minor calyx opens into the major calyx. Then major calyx opens into the renal pelvis. So you can see the renal pelvis also here. So once again I will repeat, this is the coronal section of the right kidney. You are seeing the outer cortex and the inner medulla. In the medulla you have triangular structures like this. This is the renal pyramids. Now the tip of the renal pyramids are known as renal papillae, which open into the minor calyx. Minor calyx open into the major calyx, and major calyx finally joins opens into the renal pelvis. Okay, apart from this you can see that between 2 renal pyramids there is extension of the cortical tissue, and this is known as the renal columns. So between the 2 renal pyramids you have the renal columns. Between the 2 renal pyramids you have the renal column. Okay, so this is the coronal section of the kidney. So today we have discussed the right and the left kidney, their gross, external and internal features. Thank you.